Hey everyone, miigwech merci beaucoup, and thank you for joining us for our Lunchtime Health Sciences webinar today on an active offer at the heart of all placements. This webinar is being delivered today by Monique Rochelot and Sylvie Silvestre, and I am Bethany Thompson, the Health Sciences Programs and Partnerships Coordinator here at Awesome University. Before we get started today, I'll do a land acknowledgement and formally introduce our speakers. In the spirit of truth and reconciliation, Awesome University respectfully acknowledges that our pan-northern campus is on the homelands of First Nations and Métis people. The university buildings we occupy in Greater Sudbury and Thunder Bay are located on the territory of the Anishinaabeg Nation, specifically Tikimishing and Wanapitei First Nations and Fort William First Nation. Beyond a land acknowledgement, we understand that reconciliation is a practice. We gratefully acknowledge the elders and knowledge keepers who share their gifts and teachings with us so that we may better understand and honor their wisdom and that of all the traditional keepers of this land. Awesome University will continue to practice reconciliation by listening, learning, and fostering a culture of mutual respect and trust. For today's agenda, we'll have a 5-minute introduction and welcome. As well, following that, we'll do the webinar presentation and we will have a section at the end for the moderated Q&A. This is a friendly reminder to please keep your microphone off for the duration of the webinar unless you're asking a question or responding to a question posed by the speakers. This will help to limit background noise for everybody. This webinar is being recorded and will be posted to the Rehabilitation Sciences and Dietetic Practicum Program web pages. All of our previous webinars are on the NAWSOM YouTube channel, and you can find the links to those recordings on our Rehabilitation Sciences and Dietetic Practicum Program web pages in the resource sections. You can review these archive webinars at any time and receive a certificate for your professional development records when you complete an evaluation. If you do have any questions throughout the presentation, please feel free to put the questions in the chat. We will also have a moderated Q&A period at the end of today's webinar where our speakers will answer any questions that you may have. I'd like to introduce our speakers today. Our first is Monique Rochelot. Monique is the Associate Executive Director of the Réseau de mieux-être francophone du Nord de l'Ontario. She holds a master's degree in social work from Laurentian University. Monique is a bilingual senior leader with over 30 years of progressive experience in both health and social service sectors, recognized and respected as an authentic and empowering individual with a community mindset, deeply committed to an equitable and inclusive access to care for all. Monique is a francophone from Northern Ontario. She is passionate about her culture and is always willing to contribute to the development of the francophone community. Thanks so much for joining us today, Monique. Our second speaker today is Sylvie Silvestre. Sylvie holds a master's degree in clinical psychology from Université Laval. She has over 20 years of experience in mental health and addictions, as well as in community support services, having worked as a frontline staff and manager. Ms. Silvestre is currently a community engagement and planning officer for the Réseau de mieux-être francophone du Nord de l'Ontario. Sylvie is also involved in her community. She is the chair of the club Richelieu Les Pères du Nord in Timmins, chair of the Réseau francophone des conseils de famille Ontario, a francophone network of long-term care family councils of Ontario, past chair of the family council of the Big Nucolo residents in Chapleau. Sylvie also sits on the board of directors of the Fédération des aînés et retraités francophones de l'Ontario for the Northern Region, a federation of francophone seniors and retirees in Ontario. I'd like to welcome you both to today's presentation and thank you so much. I'm going to hand it over to Sylvie and Monique and just give me a moment to pull up those slides there.
Thank you, Bethany. And I see that you practice your French just having to read our bios. That's awesome. Thank you so much.
Thank
I really
you.
appreciate that. She was telling us how she had learned French. She did French immersion, so we gave her another chance to practice her French because she doesn't get the opportunity that often.
Exactly.
That's great.
Yeah, that was what I was doing in preparation just before this, just to make sure that I had all my pronunciation correctly. So I'm glad that that it all worked out there.
You did awesome. That's super.
Thank you so much.
Once you get the slide up, actually, we can skip the land acknowledgement because you've done one, so we won't need to do it. So we can go to slide 4 once you get ready. No problem.
Sounds great.
We'll save some time at our end.
There you go.
So basically what Sylvie and I will do while Bethany's getting the slides ready, and I really thank Bethany for helping us out, because this white hair sometimes gets in the way of us understanding how things work, and then we get all nervous and we can't go through everything. So Bethany has agreed to go through the slides, to do the slides for us. We will be doing, there will be questions that we will ask you to answer in the Slido. So there's a QR code, and it'll be easy. We can interact also if you feel you want to. There's not a problem there, but you can also just answer on the slide. So there'll be, I can't remember, about 4 questions that we'll go through, and a little video too that we'll be playing for you. So basically what we'll be doing today, and thank you, Bethany, we're right there. So our learning objectives for this session today is we're going to look at the importance of the active offer of French language services, and especially for your placement settings. So what you can do, what it means for you, some of the challenges you may face, and some of the solutions, the things that we can do to make things better, and understand the cultural diversity of the Francophone communities. As you'll see as we move on in our presentation, the Francophonie is very diverse, especially with the immigration and newcomers. Understand how providing French language services enhances the client satisfaction. Understand the challenges and the barriers that you may face in offering French language services. We know sometimes it's not easy, so there's things that we can look at to make things a little bit better, and identify some of the solutions and resources to support the active offer. So the next slide. And as Bethany said, if you have any questions, put them in the chat. We can maybe answer them as we go along, and if not, then we can certainly look at answering them at the end. I just wanted to give you a brief overview of what the Francophone population looks like in Ontario. So the biggest pockets of Francophones will be in the Northeast and in the East. So of course, the Ottawa, Kingston region. In the Toronto area, the center, which is more of the Toronto area, you're seeing a lot more of the Francophones, the increase in the Francophone population. A lot of it has to do with a lot of the newcomers coming into and settling in the larger centers, Ottawa and Toronto. We do see some in the north, but it's not as prominent as you would see in the Toronto or Ottawa area. Northwest does have the smallest of the Francophone population, but they are still a very mighty group and concentrated in certain areas, which we'll look at later. So the next slide. So the other thing that we need to look at when we consider French language services is there is a French Language Services Act in Ontario. And this basically facilitates what we call a designation and identification process of health service providers to offer services and to do the active offer of French language services. There's also a governing body of the French Language Services Commissioner in the office, which is under the office of the Ontario Ombudsman, which are responsible for receiving any complaints. So if individuals come into an organization where they should be receiving French language services and it doesn't happen, they do have a venue of being able to either complain to the health service providers, put in a complaint, or also go to the Ontario, to the French Language Services Commission office. All right, next slide. So when we talk about the French Language Services Act, this act basically is for all government agencies and all health service providers that receive funding through the Ministry of Health. There's some exclusions, like the physicians aren't included in the group. Public health isn't included in the group, and there's other organizations, but those are the two prominent ones. So basically what it means that all organizations that receive funding from the Ministry of Health that are in a designated area or not must offer to the members of the public services in French. And this is especially true for provincial government ministries. And there's 27 designated areas in our province where they are designated to offer French language services. Next slide. This is basically what we're looking at in terms of the designation of our areas for under the French Language Services Act. Now, that doesn't mean if you're a government organization that you're situated in a non-designated area, you still need to offer French language services. If you are a government organization, it is different for health service providers. When I talk about designation of a health service provider, it's all voluntary. It's not something that Sylvie and I will go and say, you will need to be designated. It's something that the organization themselves, we work with them, and that they work towards their designation to be able to offer, well, not be able, but to offer the French language services. So all these areas across all the province of Ontario are areas that are designated under the Act, in which you will find health service providers. It's so confusing. I'm confusing everybody with this. So basically what you're looking at is the area of the Northeast. All the Northeast is designated, except for the Parry Sound area. The only area there is Callander, which is very close to North Bay. And the same applies for the eastern part of the province. So basically your two most designated areas would be your Northeast and your eastern part of the province. For your Northwest part of the province, you'll see the district of Thunder Bay, and those will be for Geraldton, Lone Lac, and Marathon, and also the areas of the Manitouage, Beardmore, Nakina, and Terrace Bay. Those areas are designated along with the township of Ignace, which is very close to Dryden. All right, next slide. And here we go, our first poll. So what I'd like to know before I go into the details of what is the active offer and what we could do, I just want to hear from you what you think. When you hear the term active offer, what comes to mind? And if you can just put in brief description of what it means, and we still have the test there when we did it yesterday. So give you a few minutes just to cue in the QR code. And there's no right or wrong answers here. So true, having the assessment tools available in French, yes, the choice of French is a preferred language. Maybe Sylvie, can you add, when we use the word prefer, can you just add basically what is, when we work with the health service providers, what we ask them when we talk about the preferred language? I know it's something that we often hear, it's a preferred language.
Yes, certainly. There are two questions that when working with health service providers, we recommend. And those two questions are, what is your mother tongue? French, English, or other? And if your mother tongue is neither French nor English because of the newcomers, in which official language are you most comfortable with? So we really like the wording most comfortable with, because oftentimes if we go and consult, especially at Emerge, we're sick, we're stressed, we're either with an elderly parent, a child, we just want to get treatment, get out of there. So if we are being asked, do you prefer services in English or French? We don't feel that sometimes there's drawbacks in terms of preferred. Well, I prefer services in English because in our head, I'm going to go home quicker, the quality will be better. I just want this to be over with. Whereas if we are asked, what language are you most comfortable with? Then it's easier for us to say, I am most comfortable in French. And that's how we prefer for clients or patients to be greeted, most comfortable as opposed to preferred.
Thanks for that. And like I said, there's no right or wrong. It's just, sometimes it's just an easier way or a better way of asking a question. So these are all great answers. Thank you so much. Someone has done their homework. This is super. So it'll make it easy for us. It'll just be a review. So this is super. Thanks so much for doing this. There'll be more questions as we move on. So the next slide. So we'll just touch upon the importance of active offer, and basically what you've shared in the Slido, this is basically what we're going to look at. So like you said, it's available at all times. It's clearly communicated. It's very visible, accessible, and it's the equivalent also the quality of the services that are there in English. And as you can see, these are two students, I think they were from the Collège Boréal, that were in placement at one of the hospitals, and they each have their Je parle français pin on them. So it could be those pins, it could be something else that easily identifies you as a person, a professional that's working in an environment that says to the individual you're working with, hey, I can converse in French. So this is what we mean by active offer, and it's exactly what you've shared with us. The next slide. So when we look at francophones are considered a minority group. If we look at the whole aspects of the different populations. So we form a minority group in the province of Ontario and actually across Canada. So like Sylvie said, we're not very inclined to request our services in French. It's just easier, and it's just, we are assimilated. We live in a community where it's just easier sometimes. You come into to receive some services and you just go with the flow. So actually there's only 2 francophones out of 5 that will actually ask for the services in French. And normally you shouldn't have to ask for them. If they're allô, bonjour, then of course, if somebody says, hi, hello, bonjour, I will actually automatically say it in French. If somebody just says, hi, can I help you? I'll go automatically in English. It's just a habit that I have. And I'm not the only one, as you can see. So looking back, French language services, they're not readily available. Sometimes it's very difficult, depending on where you live, to receive them. Not knowing if I'm going to go in and I'm going to get my services in French. And something that I do quite often when I go to see my family physician, probably once a year, I actually will Google what I know I can say in French. I'll actually Google it, what's the or go to DeepL or translate the information, have it on a piece of paper. This is what I mean, because sometimes I get there and I'm not sure how to say it. So these are just things that I've done, not realizing what I'm doing, just to make sure that the person at the other end will understand me. The habit of adapting, the assimilation piece, fear of not receiving your services as quickly as Sylvie said, just the linguistic insecurity, the other piece, oh, am I able to say this in English right? Why I Google to make sure I get the correct English terms. Fear of being considered as, oh, I'm a troublemaker, I'm going to make everybody else wait, or just lack the trust in terms of the professional ability to understand. The next slide. So even myself, that I can easily converse in both languages, I don't. I often will go and seek some additional help. So what we're going to look at next slide is how diverse our Francophone population is. So 45%, we'll start with the determinants of health. So we have 45% of the Northern Ontario Francophones feel that they're in excellent health compared to 62% of the provincial average. Most likely is that we have less tendency to get to the hospital, more rural, it's harder access healthcare professionals. And we do have professions that are, mining and forestry. Those are hard professions. So people probably have less of a tendency to take good care as if you live in an environment where you can walk easily to everywhere, easily accessible to different services compared to what we face in a lot of our communities in the north. The other piece too is the Francophones in the Northeast are a little bit less educated than what we would see in our counterparts in the southern part of the provinces, and we are an older population. On the next slide, please, we'll look at what we look like in terms of the population. So the proportion of Francophones it's 20% age 65 and over is higher than the proportion of people age 65 and over in the total population in the province. So if you look at 17 and 20%, there's a higher proportion of older Francophones in the north. And again, in Northwestern Ontario, it's still even higher. So we have that 27% in the northwestern part of the province. Next slide. The other factor that we need to consider too is for our Franco-Ontarian community is we're becoming a lot more diverse. So what we used to know as Franco-Ontarians is now changed. There's an increased number of newcomers who are coming here. Either they've moved or attending university, college, and their first French would be considered their first official language spoken. Actually, it wouldn't be their first language, but it's their first official language. There's two official languages here in Canada, French and English. And for the newcomers, French, a lot of them would be their first official language spoken, and very, very to no English at all. So as I mentioned, the French will be their second or third language for a lot of these individuals coming into and moving to Ontario. So these elements often emphasize the linguistic and cultural barriers that these individuals often encounter, and they have very little knowledge of our healthcare system. So that is another barrier for these individuals also. So the accent, the culture, they all come into play when we're offering services to what we consider, Francophones. Next slide. So I'll give you a few minutes here too. So how do you think the diversity of the Francophone community in the North impacts how you would offer French language services in your placement settings? What do you think needs to be done more? Or what can you do? A lot of us willing, depending on where we are, you may encounter more individuals that are not from the North, and some a little bit less. And this is a factor also for us as an organization that we also need to adapt to and make sure that when we go out and do engagements or consult with our partners, that we're also more inclusive in the way that we proceed to do our work. And often we will be working and partnering with organizations that are working with a lot of the newcomers, immigrants in our area. So true, when you look at the communicating and medical terminology, that is very difficult. And Sylvie will speak to that a little bit later on too, in terms of, even for anyone, it's very difficult because the way that the culture plays a big role in terms of what we use as medical terms. Sylvie and I were talking about yesterday, or this morning too, what's an MRI in French? A CT scan. We don't even, it's like the word is long like this. Yes, the diversity shows the importance of active offer will look for perceived health and education. Communicating in French may help with understand. Absolutely. Diversity may impact which organizations focus on active offer. Yes, for sure. The ability to be adaptable and willing to collaborate with outside organizations. That's key. Don't be afraid to ask and to seek help from organizations that work with the newcomers, that are able to offer these services, offer French language services at the same time, and for sure, have a translator applicable, available in different languages. That's key, and there's different services out there. We do have a service that is often used as Voice, VOYCE, sorry, which they have different languages. We did a test run with them, and they said it was Northern Ontario French. And then when the lady came on, she was speaking this Parisian French, and we were like, oh, this is, so we had to go back to Boots and say, this is not, the common French that we have in the North. We have to ensure that we're seeing each person as an individual. So important. The client is the focus, at the center, rather than assuming, believing a stereotype. Even though there's two clients both speak French, they do not have the same background. So true. Culture plays a big role. And even in the North, for Northern Ontario, often our dialect is different. The terminology that we use is different. And a lot of the people, also individuals that you may have taken French immersion in, let's say in the southern part of the province, that French is very different than, and you come and practice in the North, or you move to the North and you say, oh, I don't use that term, but it's so true. But it's all good. I mean, there's no right or wrong. It's a way of how do we get around to understanding each other. We don't need to be, and Sylvia will speak about that, not to be scared, even though we do have how can I say it? Like having an accent. Not to be scared doesn't matter. Doesn't matter at all. There's no right or wrong French. All French is good. There's no right or wrong English. All English is good. Use principles of supported conversation. Confirm that you understand. That is so true and so important. So thank you. Thank you for your comments. They're all really great. So the next slide. So as we spoke, as we were speaking, so if we're looking at offering a services that's equitable, it's also a matter of safety. And as some of the comments that from the last slide out, it's important to understand and make sure that the person understands what you've just shared with them. And it reduces the risk of the person coming back, often not understanding where they're at. Again, your length of stay, if you repeat in terms of going back to emerge or going back to the doctor, or coming back to a clinic for services because they don't understand. The next slide, please. So your positive impacts, I'll go through it quickly because you've looked at it already, is the ability to express and explain the symptoms, understanding the treatment, and improving the experience, and again, better management of one's health. I understand where I need to go. I understand what I need to do to feel better. And the next slide. And again, a more positive impact for you as healthcare professionals is you feel, okay, you have an accuracy of the assessment that was completed on this individual, on this client or patient, better interaction during the treatment or during the session, the communication, you found ways of communicating with your with your client or your patient. It doesn't need to be perfect. All is good. And then it improves the overall experience for yourself and also for your patient or your client. Next slide. And Sylvie, turn it over to you, and you start with the Slido. Awesome.
Yeah, I know. I start with a Slido. Okay. So now that you've heard Monique talk about active offer, definition, different examples, how can you integrate those principles of active offer into your current placement setting? And are there any challenges that you foresee? It's always interesting to see what the future healthcare professionals have to say. Really enjoy presentations with students. So a challenge, not knowing who speaks French. Yes, very important. That's one of the things we tell health service providers. Have a list of your French speaking staff, assess them as well to see at what level they are at. Are they basic, intermediate, advanced, superior? So not knowing who speaks French is very important to have, being able to get those who do help with the patient when they would be managing their own caseload. Yes, Francophones have been known to hide because they know that we're going to go and get them, and their caseload is going to be heavier than somebody else. So we really have to do a lot of awareness about the importance of not hiding and the importance for the employer to make sure that the caseload is not too heavy on a Francophone. So utilizing common phrases that were received in my orientation package. Oh, wonderful. We do have cheat sheets as well that we have developed, and it's as simple as un moment, s'il vous plaît, and lifting a finger. So things like that, or pointing to the sign, services are available in French and English here, and the message in French. I love phrasing the question as which language you are most comfortable. Thank you. Thank you. Being unsure if I'm conveying my message to the patient sufficiently when trying to communicate in French. So that's why a while ago somebody said it's really important to ask them, repeat to me what I've just said to you to make sure that the message has been conveyed. Organizational policies may make implementation challenging, for example, wearing additional tags to identify as French speaking. Absolutely right. And what I say when I'm in the field is what is not going to be additional and is free is hello, bonjour. Doesn't cost anything. And people really, really appreciate that. Beginning an interaction with the client, patient caregiving by offering either language as possible. Yes, I can see possible challenges with finding French options for important forms such as consent, case history. Yes, and that is something we remind health service providers who are designated or identified. They have access to a Ministry of Health and Ministry of Long-Term Care funded translation service. So it is free to them. Anything that is for your clientele or for the general public is free. You can send it in. And the turnaround time may be a day up to 2 weeks. So it's really to use that so that when Monique was saying that, active offer is readily available, that's what comes to mind to me, is that the Francophone is not having to wait for you to search on your computer to print the form, but best practice, it's printed in English on one side and French on the other side, and here you go. Okay. Yeah, thank you. Thank you. Wonderful feedback. I love it. Okay, so I'm just going to go over linguistic insecurity. Monique did mention it very briefly. So here's a definition of linguistic insecurity. It's the impression or the belief or the feeling that the way we speak or our level of language isn't right or isn't as good as other people's. And I have to admit, I've been through that before, especially in my written French. When I started at this job 13 and a half years ago, I was stuck in front of my computer writing in French. I had lost it. And it would take me forever to press send because I was so aware, what if I'm making a mistake? What if I look bad? What if somebody is writing back to me and their French is like perfect? And at one point, it's just like, who cares? I'm going to get my point across. My employer has provided different tools for me to be able to correct my French and to learn it. Now it's with AI, it's becoming a lot easier to do that. But there are still at times when we do see linguistic insecurity. Okay, and the next slide goes over just some of the linguistic insecurity. And Monique and I, yes, we were talking yesterday, we were talking this morning about the different medical terminology. I don't have a medical background. So, if I'm having to translate, and I remember, and I'm not going to go over all of them, but it's really important to understand that sometimes mistakes are made because when we're using our common French and not the medical terminology French, you can't translate word for word. And I remember one time I'm with my dad at Emerge and he's vomiting. And then the resident comes in and she said to my dad, she said, does your heart hurt? Avez-vous mal au cœur? But I'm sorry, she said, avez-vous mal au cœur? Which means, are you nauseous? And then my dad was like, yes, but what she meant was, does your heart hurt? And so when he said yes, she's like, well, tell me where, point where. And so she's expecting him to point at his chest, but he's pointing at his stomach and he's looking at me like, j'ai mal au cœur. She should know that it's I'm vomiting. But she had the literal translation until I realized, oh my God, you're thinking he's got chest pains. No, mal au cœur means he's nauseous. And so there's lots of examples. I remember when I was 16, I accompanied my mom to the doctor, and she's trying to explain that she's got lower back pain. Well, she used the expression mal au rein. And I'm like, I know this. Well, I didn't Google it at the time. I'm sorry. I'm just showing my age. I did look it up in the dictionary. Rein is kidney. And I said to the doctor, her kidneys hurt. And what I meant is she's got lower back pain. And to this day, I don't know if the doctor understood the expression, if he prescribed the right medication, or if he, sent her for some tests, some kidney tests, and so on. It's really important that we have different terms and we can't translate word for word. Right? So back to the linguistic insecurity, we see it not only among ourselves, but we see it among healthcare professionals as well. They sometimes are concerned that they're going to take more time to find their words, to express themselves, and they fear that they're not going to be understood or they're not going to understand the person in front of them. And they are concerned that they have very limited vocabulary in French, not just medical, but general vocabulary. So it really is a matter of overcoming that linguistic insecurity, whether it's finding opportunities to practice your French, just the way Bethany is doing when we met with her. It's taking courses, it's having, let's go for lunch and we're going to choose a topic and we're just going to talk about these terms so that I get more familiar with them. And for the linguistic insecurity among Francophones is that the reality is Francophones who are able to speak English well, just like me, will sometimes avoid speaking French or identifying themselves as French. Like we said a while ago, We are afraid we're going to wait longer. We're not going to be understood. We're going to be judged. We're going to be seen as a troublemaker. Okay. So to counter that language insecurity, it's really, really important to identify the person's mother tongue and the official language, French or English, in which they are most comfortable receiving services. So some of the impacts of the language barriers, if we're not able to communicate amongst ourselves, the healthcare professional, you as a student with your clientele, with your patients, is that there could be delays or lack of follow-ups in treatments, increased number of diagnostic errors in treatments. I have a ton of testimonials. I was a caregiver to my parents for 10 years, but I remember one time my mother had to go to Emerge, and I wasn't with her at the time, and she speaks very, very little English. And she went to Emerge by herself and with severe abdominal pain. And she came out of there a couple of hours later and she called me. She says, I went in with severe abdominal pain and I think they told me I have an ear infection and they gave me a medication, but I'm not quite sure how to take it. And I think they told me to see my doctor, but I don't know if they said 1 day, 1 week, or 1 month. Ooh, was I ever livid? Because this was in a hospital that is designated under the French Language Services Act, and they have to guarantee that they provide services in French. So, I had to do the follow-up and what's going on. And so increased number of diagnostic errors, increased occurrences of critical incidents due to professional errors, misunderstanding of the diagnosis, and then having to send francophones more often to specialists. And because I'm not quite sure what they said, so I'll just refer them to the specialist and they'll figure it out. Sometimes there's unnecessary hospitalizations because they didn't understand, so they weren't able to manage their illness. So they go back to Emerge and then admitted to hospital, and the cycle continues. Okay. We have to be aware that there are misconceptions about language barriers. We often hear, well, people who speak a little bit of English or who are bilingual, they can do without professionals who speak their language, or they can do without an interpreter. So we really, really have to raise awareness and correct that misconception by saying that situation, believing that, can create an illusion of communication. And we have to understand that when we're in a crisis situation, when we're stressed out, when we need to understand a very complex diagnosis, even people like me who seem perfectly bilingual, we may need services in our mother tongue. So just want to go back. Yeah, no, it's okay. Whoop, look at that. The situation of creating an illusion of communication, I did witness that with my dad when he was admitted in cardiology for 6 days. And I had one staff who was adamant that my dad could understand her. So she would talk to him slower, louder, and in a baby-like fashion. And I'm like, oh my God. So I really had to stop saying, my dad only understands French. And I had to say, I had to stop saying my dad only speaks French and have to say my dad only understands French. No, she didn't believe me. She kept going and talking. And then she has the nerve to tell me, see, he's smiling at me. He understands me. And I'm like, I felt like kicking my dad, saying, stop smiling. Okay. But he's the one who didn't want to be a troublemaker. So I'm going to just smile and play along. And I remember my mom saying, wee, wee, wee. And she didn't understand a word. Yeah, but she didn't want to let on. So the second misconception is that language barriers are eliminated by asking a bilingual family member like myself or an informal interpreter to interpret. Okay, I do a lot of my testimonials to explain that I don't have a medical background. I can do the best, and I have done the best, and now I realize the dangers, the risks, that I may make some errors, whether intentional or non-intentional, when I'm doing the interpretation. And that, you know what, I wasn't fair to my dad because of the ethical risk, because of the confidentiality. Maybe there are things that he didn't say to his family doctor because he didn't want his daughter to know. So where was the confidentiality when I was doing the interpretation? Okay. So we have a short video next. And I'm mindful of the time. I have 5 minutes left.
But one thing I can say about Ontario, as you say, where people live bilingually a lot, at least most of the francophones, one idea is for the professionals to be aware of this aspect, that their patient can switch languages from one to the other. From what we see from francophones, sometimes they feel more comfortable to speak French, but they don't always know the terms, like the health terms or whatever in English. So even them, they're not sure if they should require their services in French, knowing that they're going to switch back and forth between French and English. So that is a typical or an atypical context where patients will switch from one language to another. So our team is actually starting to look at that, what is called code switching, alternance codique en français, so that professionals are aware and ready for this, that the patient will switch from one language to the other. This is how the context works. This is how we work. I'm the same.
I agree with my colleague here that for a Franco-Ontarian, we have a tendency to overestimate the second language competency, even among Franco-Ontarian, because they learn mostly even if they go to school in French, they socialize in English, and what I call a street bilingual. So they have a limited numbers of vocabulary in French as well as in English, and it's why they switch back and forth. Also, the other thing is that in Ontario, if you ask the francophone, if it is important to have their service in French, especially medical services, they will say over 80%. But if you ask them, if it's difficult to have access to it, they will say yes, it is, and it will vary between region. In the Ottawa region, it's much more easier to have service because you have about 40% of the population of French, and you have about 40% of the clinicians who are bilingual. But if you go in the center of Toronto, you have 30% of French, but you only have about 8% of the clinician that could offer service in French. The other things you have to have in mind also, it always depends on the problems that you consult for. If you come for a bone fracture, even if there was an error, to make a diagnosis, it's a little bit more easier than if you come for abdominal pain per se. And if you have a high pain, most people will have tendency to prefer to express their symptoms in their first language, in their mother tongue language. So there is a range of the impact of what I call linguistic discordance on the patient as well.
Okay, yeah. That really is a reality, and it really strikes with me, and talking to Monique as well about the street language and, switching from one language to another. And oftentimes, as a bilingual professional, you have to follow and adapt or adjust your French to the person in front of you. So if the person is saying, j'ai eu un stroke, because even this morning, I know the acronym, is it an AVC or is it an ACV? And I can't remember. So I was just like, you know what? I'm not going to worry about it. I'm just going to say un stroke because I know what un stroke is. So it really is that, we're talking back and forth. And je vais aller pour un MRI. Because I can't remember what the acronym, I know the letters are reversed somehow, but it was just like, in Northern Ontario, in Timmins, I know MRI is an MRI. So, and a CAT scan, c'est un CAT scan. So that this is how we, go back and forth, and we switch from English to French. So the next, oh yes, here as a French-speaking healthcare professional, here are things that you can do. Advise that, if you have an accent, has nothing to do with the quality of the message that you're delivering. And, who was saying a while ago to rephrase to make sure that you have the correct understanding, and tell me in your own words what you understand. And as an English-speaking healthcare professional or future healthcare professional, there's things that you can also do. You don't have to speak French to be able to do an active offer, but you can use appropriate translators, interpreters. Go and get some of your colleagues, if they've been identified, refer to other health service providers who have the capacity to offer services in French. Learn some common short phrases, look at our cheat sheets. And do indicate that you're aware that the person is not comfortable in English, and make an effort to understand somebody a while ago talked about gestures and pictures. I wrote it down. I'm like, yeah, that's a good one as well. So I think, yeah, we've covered this, simple as raise your finger, s'il vous plaît, point to the sign, ask your French-speaking colleagues. And if you want to go on our website, there's a ton of resources from our online training on active offer, whether it's a 3-hour format, the 45-minute module in primary care, mental health and addictions, or long-term care. You'll find a lot of those resources. So the last Slido question is, what tools or strategies from today's presentation do you think will be most helpful to you in creating that environment of active offer? Reviewing the courses on the website. Yeah, sounds good. Always good to review. Even I learn new things every day. Health service providers share their best practices. And when they share a best practice, man, am I ever happy to go back to work and say, hey, look what so-and-so is doing. This is a best practice. Starting off a conversation with, what language are you most comfortable using? Thank you. Thank you for pointing that out, saying it. The cheat sheet of common phrases would be very helpful. We have one, and we even wrote phonetically how to say the short phrases. Learning some French phrases and who to approach in my ward that can speak French. Yeah, I know in New Brunswick there's an initiative that was developed, and it's called Café de Paris. And so during a break, people get together for 15 minutes, they pick a topic, and we're going to practice our French with that particular topic as the Café de Paris. Not to worry so much about my French being perfect, and just try my best to provide the active offer. Yes, absolutely. You know what? My French isn't perfect either. And I've overcome some of my linguistic insecurity, especially the written form, as I was saying. So those are all good points. There's a question in the chat, Bethany. I saw it. I just saw the word translation.
Get a question in the chat. Could you touch on the free translation services that you discussed and how to access these?
Yeah, the guidelines are actually on our website, and the service is provided out of Niagara Health, but for the entire province. And basically, the guidelines indicate that for designated and identified providers, anything that is related, and it can be also on your website, anything that's related that will go out to your clients, to the public, anything on your social media, you can send in. There's a request form for the free translation. Anything that if your internal language, your working language is English, so anything internal policies, no, that you can't have that translated. That's for your staff. It's not for the general public. So that won't work, but it's very clear with the guidelines that we have. And there is a pilot project as well until March 2026. All of the long-term care homes in the province have now access to the free translation service. So not just whether you're identified or designated, but also those who are non-designated, non-identified. Until March 2026, they have access to that free service. Does that help?
Bethany, we can also put, or I can try to put it here, but I can also send the link to you on the website and then share with the participants. Would that be easier than putting it in the chat?
Sure, yeah. If you wanted to email that to me, then I can email it after
I will do that.
the chat today.
Yeah, so Amy will send out the link for sure.
That's good. Thank you.
Okay. So I realize we have 5 minutes left. We do want your feedback, so please, if you can take a few minutes to scan the QR code. We really are looking forward to your honest feedback. We're always looking at what we did well, what we can do to improve in our presentations and our activities. So thank you for taking maybe 2, 3, 4 minutes of your time to give us your feedback. Any other questions, either from myself or from Monique? Or comments?
I was
Or
just gonna,
testimonials?
I was going to mention when you folks were talking about linguistic insecurity, and if you're not comfortable with the level of French that you might have, as say if your mother tongue is English, one of the things I thought of when I was trying to get back into and learn more French is I had read a book in French that I had already read in English, so I knew the content of it. It was the first Harry Potter book is the one that I picked, but yeah, so it was, I already knew, I knew the story, so I could kind of put together, okay, well, this is what this word means, right? And it just kind of started to come back to me. So that's one of the things I thought of when you were saying of ways to practice. If you, you say, well, we'll go to lunch and pick one topic.
I did not have that in my toolbox, Bethany, but I will add it.
Perfect.
It never occurred to me. See, learn something new every day.
And even as a francophone, like you do most of your studies in English, and then then I went and worked, in private practice, and Ministry of Social Services, Ministry of Health, all in English. And then I work for a francophone organization. Do you think I could actually write in French? Absolutely not. I had to relearn, and I'm a francophone, so it's. I mean, even for us, it's like Sylvie said. Like it took me a year, but got back into the groove of things because you don't do your studies completely in French, so it's you're working in English and you did most of your studies in English, so it's kind of hard, but you get back into it, not to be scared.
Absolutely. That's great. Thank you both so much for joining the call today and giving this presentation. It was very, very insightful and very helpful. And I'm sure the learners on the call certainly agree. And as some of them have noted, they've got to sign off and get back to their clinical placements. But thank you both so much. And we'll be sure to send out that link that you sent in the chat here, Monique, and connect any learners with you that might have any questions as well.
Perfect.
Thank you.
Thank you.